but you spoke about organizing. So maybe talk to us about the importance of organizing. How did that come up for you, and how does that like play an important role in public health?
Of course, yeah. So, I come from a very socially active family. Even when we were facing a lot of difficulty and socioeconomic stresses, my parents were very particular about giving back and staying connected. And if you, I mean, you growing up in the part of the world that we both did, community is a huge way of looking at the world and interacting with the world, right? It's a lot different from how we see ourselves as individuals and as members of the community in places like America, because in my part of the world, especially in Southern Indian culture, you are a member of that unit. You are, your whole village, your whole town is a family. You look after each other, right? And my grandfather was a community organizer in India. He played a very, he was a frontline organizer in a lot of the labor organizing and community organizing back just after India got its independence, as we were transitioning into a democracy. He learned and worked and sharpened a lot of those skills. I would say in the public space, and he passed that on to my mother. Both my parents are very involved in community. So I grew up with that perspective. I grew up with the perspective of, staying connected, staying involved, looking after one another. And when I came to America and, kind of came into my own as a public health professional and as a younger professional as well, as I was learning the ropes of healthcare and healthcare access, as I witnessed health disparities and started contemplating on health equity and health access equity. One thing I really noticed was that there's two parts of this, right? There's a systemic part of this that has all of the infrastructure and the structures that are required for building a robust, more equitable healthcare ecosystem, but also that carries so much burden from the historic inequities and historic disparities that still continue to this day, that differentiate communities and groups of people and impact and create epigenetic scars that never truly heal, that just scab over. And those epigenetic scars are such a hurdle, a hurdle to building, an equitable healthcare understanding of healthcare, equitable understanding of healthcare. And there is no way somebody from outside this lived experience, outside this lived reality, can come in and fix it. I don't think that's how it works. And I think any attempt to do that will essentially, silence the very people that we are trying to empower. So it is absolutely important that the people who are the most disenfranchised, who have the most hurdles to health access and health equity, and any access and any equity for that matter, those are the people who should be involved in liberating their own communities. And those are the people who should be equipped with the skills and tools and systems and structures to advocate for themselves, to have the power to fight for themselves. And the way to get that, to go from A to B, is organizing. Organizing is the tool to take something that should belong to all of us and make sure that it belongs to all of us. Organizing is mobilizing people to stand up and help each other stand up and raise their community up with them. And I think that perspective of, I have a professional career where I'm working on, my public health work. And then in organizing, it's a little bit more dispersed. It's not specifically just health or medicine. I'm working on homelessness. I'm working on food security. I'm working on the school to prison pipeline. I'm working on raising the floor for children who are being prosecuted as adults. And I'm looking at all of these different issues that at first glance, someone might not think are related to health, But all of these things are the burden that is placed differentially on communities, differentially on people, individuals, families, that prevent them from being able to advocate for their own rights, both in healthcare and in other areas, that prevent them from being able to reach and access these systems that cause these disparities. So organizing is that crucial puzzle piece for me, from connecting from A to B, okay, taking the ability to advocate for oneself and giving it to the people. So mostly democratizing the self-efficacy. I think that's a good way to put it. It democratizes self-efficacy. And so that's how I think, even in places where I'm not actively organizing, I'm always thinking like an organizer. That's how I approach public health. Because the findings that we come up with in our when we're doing a mixed method analysis or like community health assessment, the what we find out, our findings, they are no use to anybody until the people can use those findings to make a better health system for tomorrow. And that's that puzzle piece there.
I appreciate that answer, and I'll go one further in saying, like, we need those people to be a part of the solutions, and I think, like, to your point, is how do we continue to center those voices that have been unheard, that have been most marginalized, that haven't been given space, time, capacity to voice their concerns, their needs, and really be on those platforms. And I think that is the essential job that we have to do to get to, like, self-realization, not only health realization,
Absolutely.
but self-realization. So greatly appreciate that as well. That was awesome.